I'm Dr. Matthew May. I'm a hip and pelvis surgeon with North Florida Bone and Joint Specialists. We're here to talk about SI joint fusion today. The sacroiliac joint joins the pelvis at the ilium to the bottom of the spine, the sacrum, stabilized by ligaments and muscles, and normally has very little motion. However, it can increase its motion due to degeneration. This can weaken the ligaments and connection of the sacroiliac joint over time, leading to pain and dysfunction that requires treatment. SI joint pain is relatively common. It's often misdiagnosed in lots of people and is a chronic issue leading to pain. Usually it is secondary to low back and hip issues. However, it can cause significant issues, particularly in people who've had prior surgeries in the lumbar spine and hip. When I see patients with sacroiliitis or arthritis, they complain of pain posterior in the pelvis, behind the hip joint, and below the bottom of the spine. It can also sometimes cause nerve irritation down the leg. In patients with chronic low back pain, when you want to distinguish whether it's the SI joint versus the low back, the history obviously clues you into the location of the pain and whether it's the SI joint. Pushing directly on the SI joint hurts when it is the SI joint, and that is different from the areas in the lower back. It also hurts with provocative maneuvers such as loading the SI joint. And then we confirm the diagnosis doing a diagnostic injection into the SI joint, either under ultrasound or x-ray. We numb up the area, and then we will inject into the SI joint numbing medicine and a steroid typically. And if you get very good relief from injection of the SI joint, that helps us clue into the SI joint as the problem. When you have SI joint arthritis and dysfunction, it doesn't necessarily always mean you need to have surgery. Non-operative treatments are always tried first, which include SI stabilization belts, physical therapy. Sometimes injections can last for a long time. Certain anti-inflammatories in patients who can tolerate them or don't have medical conditions preventing them from taking them can help people. Also, avoidance of certain activities can also help. When you've failed conservative treatment and the SI joint arthritis is causing significant issues with your daily life and activities, proceeding with surgery does provide long-lasting benefit for most people, particularly if they want to get on with their life and treat the pain. I perform the SI joint fusion using the iFuse implants. It's a 2 to 3 centimeter incision. We use 2 or 3 implants which stabilize the joint immediately. They're very strong, rigid implants that allow bone growth, allowing the SI joint to fuse, leading to long-term pain relief. As a hip and pelvis surgeon, I'm a little more uncommon than most people who do SI joint surgery. The hip does affect the back and SI joint commonly, and therefore I would see patients with chronic back pain who'd had multiple surgeries on their back, and I'm treating them for their hip and they still have lots of SI joint pain. If you have chronic posterior hip and pelvis pain that hinders your activities, we would love to have you contact our office to come in to be evaluated.